it's Sanskrit here, and today I will talk about coronavirus, which is basically COVID-19. Before starting the video, I must tell you, please avoid the WhatsApp rumors and the misinformation that you get, because that is really not important right now to digress through what is the main cause or what are the main precautions that you need to take. Secondly, the sources, be it bags, bioweapons, etc., are totally not important right now. What is important is that you take precautions, and that's why this video is all about precautions and safety. For the general public, obviously. So, for the first thing that you need to remember about taking precaution is being very hygienic. You need to maintain health and hygiene at any cost. If you are coughing or sneezing, please take tissue papers, and if tissue papers are not in your range, sneeze on your sleeve, okay? And after that, please discard that tissue paper in a covered dustbin, which means that you need to keep your hands also washed and wash your hands. There is also a method to wash hands. I must tell you that take warm soapy water, and after washing for 20 seconds, then please do other works, because touching your face or doing any other work with unwashed hands can actually be very, very dangerous right now. Secondly, please, if you're having any kind of uneasiness, or if you're having cough, cold, symptoms of like short breathlessness and other symptoms of illness, please remain indoors and isolate yourself for 2 weeks. And if you think that you're actually having kind of like a severe case or so, then please immediately go to the doctor. And do not try to go to like the emergency ward or basically the simple normal wards, right? So try to directly go to the infectious disease ward, and while you're going to the hospital to get the symptoms checked of coronavirus, please try to use private transport and avoid public transport, because it's for your safety and for everybody else around you. Thirdly, as I told, please avoid WhatsApp rumors that are mostly telling to use masks, etc. What you need to know is that mask is not for the general public. Mask is more for the professional people like doctors, ambulance workers, and builders. So if you're going to be using those kind of like masks, which are basically specialized and not generalized masks, then you're actually taking their health and their whole life safety at cost. And because of which, a lot of doctors died because they were not having the protection required at that particular time while treating patients. So please leave the mask for the specialized people. And if you think that you actually need masks, please use these kind of masks, which actually contain N95 filter, PM 2.5 filtration. I would advise to use these kind of masks if you are thinking that you're actually having severe cases of cold and cough, and this would be a good one for you to use. And it's not for general public, as I told, so please avoid using and spending on these things. Also with that, you can actually use these kind of sanitizers. They are having small loops, so whenever somebody comes to your house, you can just hang it there and they can use it. And you can keep some handy in your bags too, because you never know when you need them. And so whatever information I have given to you, please adhere to those. And a lot of information like using herbal teas, or even people recommended smoking. So we do not know actually that it can cure or not. And therefore, I would suggest that rather do not do those, because it can actually worsen your health more. And that's not what we want exactly right now. Instead, go to a doctor and get recommendations that you actually think that you should get, right? And if you're worrying about that, what could be the cure, or if it persists for a long time, so don't worry. In around 18 months, we would have vaccines for coronavirus, and until then, we are having some kind of like side kicks or something. So side ones are actually being tested. We are not giving directly to the general public right now, because it's for everyone's safety. Now for everyone's safety, we need to test on several specimens, animals, etc. And once it is actually done, we will make it official, right? But till then, it's on you to be very more precautious. Please avoid having direct contact, especially like as germaphobes, you need to behave this time, and avoid going to the crowded place right now, because it is for your safety only. And that's all for today. So please try to remember that whatever precaution you are taking, it's for your own safety, and you do not have to keep your life or safety at others' risk. If you're having kids or so, take their care, because it's really important right now to make people understand. Share this video with a lot of people, because you never know that whose life you could save right? So please follow these kind of precautions and immediately seek to the doctor. Please do not wait for your self-treatment things because it's not gonna work right now. Thank you so much. Bye.